Hello everyone. In our video series on recurrent or failed hernias, let us see what do you do when somebody has a recurrent hernia. Do they need treatment? And if yes, what sort of treatment is needed? How do you manage these patients who have got a recurrent hernia? Number one, patients who have a hernia which is recurred following a previous repair definitely need treatment. You cannot delay or avoid treating a recurrent hernia. Why is it so? Suppose number one reason, suppose somebody has got a hernia repair in the past and now they have come back with a small bulge on the repair site. Usually the recurrence happens through a very small opening, which means you can fix the recurrence many a time with a laparoscopic repair, avoiding an open surgery in such patients. Number two, if the recurrence is not treated, this hernia is going to increase in size. So the defect which was initially very small is going to stretch, expand, and the patient invariably ends up with a very large hernia which might have to be treated with another open operation, and the chance of that operation failing is also high. So it is always preferable to treat a recurrence much early when the defect is small. Third, in case the patient has a recurrence and there is no treatment done for the recurrence, the patient might suddenly come in the emergency with the intestines getting blocked into the recurrence, and in such a scenario they might need emergency surgery. And in an emergency situation there is a possibility that one may not be able to repair it with a mesh, because sometimes there can be damage to the intestine, there can be infection, and that can prevent one from placing a mesh for the recurrence, and one has to only do a stitch repair, and this repair has a very high chance of failing in the future, and the patient might end up needing another third operation to have a permanent fix of the hernia. So it's always preferable to detect recurrences of hernias much early and fix them as early as possible when the defect is small and when it is uncomplicated, rather than waiting for the recurrence to enlarge in size and land up with a much more difficult problem in the future. With every recurrence, like every hernia which has recurred 2 times, 3 times, with every surgery the chance of permanent cure or success keeps decreasing. So usually our rule is the first repair should be the best repair, and there has to be every effort made to decrease the chance of recurrence. In case a recurrence happens, it should be managed very early when the defect is small, and that can be achieved many a time with a laparoscopic repair.